Hey everyone, welcome to Digital Inclusion Exchange, a podcast by Digital Charlotte, a project of the Knight School of Communication at Queen's University of Charlotte. My name is Andrew Au, Director of Operation.
And my name is Bruce Clark, Executive Director of Digital Charlotte.
My name is Maria Jimenez. I'm Production Coordinator and Senior at Queen's University of Charlotte.
Good morning, everybody. Thanks for joining us, whether you're watching us live right now or perhaps watching the recording at a different time. We are thrilled this morning. Andrew, Maria, and myself, who are part of the Digital Charlotte team here, are thrilled to be with Dr. Zachary White. He's Associate Professor of Communication in the Knight School of Communication at Queen's University of Charlotte. Dr. White, thanks for joining us today.
Good morning, everybody.
Morning.
So I think the first question, just this conversation today we wanted to have with you, your expertise. We've had the pleasure of getting to know you over our several years now, but really excited to be in this moment and to hear your thoughts because of your expertise on connecting and digital and health literacy. But before we even ask any of those questions, really just wanted to ask you how you're doing, how your family's doing, what is life like now for you? Hear from you personally.
Well, I think it's like most others right now, trying to establish new routines and habits here in the midst of uncertainty. And, it's those amazing things in which this is what I study. And this is kind of at the crux of not just talking about it and thinking about it, but seeing how this impacts people across the board. If we have family and friends in other parts of the country or other parts of the world, more than ever before, just aware of kind of a care consciousness that is overwhelming to think about at times, and also at times doesn't feel real, and then at times feels more real than you'd ever want it to feel. And, these abstract issues that sometimes we talk about become very real quickly. We're talking about family and friends and colleagues who we see lives being interrupted or impacted in a variety of both small and major ways, subtle and obvious ways. So now, depending on where you are in the country, your new normal is new for some and not as new for others. And we're bombarded with kind of mediated messages that tell us about at a kind of macro level. And then we're also looking at our neighborhood, the ways in which our habits are upended. And we were just talking before we went live here about just different ways of understanding a week changes, our interpretation of time and the ways in which we relate to our family and friends when in essence choice is taken away. And so we're doing well, we're safe. And of course, my thoughts go out to all of those in the hardest hit areas right now and across and throughout the United States.
Mm-hmm. I was, it was a couple of weeks ago, or it was actually a couple of months ago, we were collaborating on a project and I needed your bio and you sent it over to me and then I pulled it out again, obviously, for this meeting, and we were sharing it in our group chat as we were preparing messages to send out today. And in this line that, you mentioned that you studied this, but this line that Dr. White's academic research and teaching focus on helping people manage meaning and communicate challenging life experiences amidst high levels of uncertainty. And I like it to your point, like, is there ever been in your entire career, or perhaps maybe a better way is like, what other moments in your career and your study and your academic research of this even come close to this example we're living, hitting that line? Is there anything else you can think of?
No, I mean, in terms of the way in which it's more democratized than ever before. Usually what I study is how people in health situations are trying to manage and make experiences in which their scripts for making sense of everyday life is upended. And usually those people are marginalized. We're talking about disabled. We're talking about people who are living with and coping with chronic health conditions. We're talking about caregivers. We're talking about people who live on the margins of society, oftentimes unnoticed. But what's happened in the last month, 2 months, is a consciousness of fragility and vulnerability that I think that in the modern world we have not experienced. We are a remarkably globalized world and society, and what is overwhelming at the one hand is that we recognize and cannot escape the fact that we are, in essence, what Marshall McLuhan called a global village. And our globalism and our interrelatedness, which is a strength, is also right now a type of vulnerability in terms of how do we reconcile our relationships with other people. And so what has been really moving to me is the things that I've been talking about and sharing with caregivers across the lifespan is now what everyday people are experiencing. There's 44 million caregivers in the United States alone, and it's as if they and the people that I study, the people who have taught me so much, can teach us so much during this time. So maybe hopefully during this hour we can talk a little bit about what they experienced, that I think all of us find ourselves in positions of care or thinking about care as impacting our relationships, as impacting how we think about our physical health, thinking about how we will care for our loved ones if something happens to one of us, if we're in a family or a relationship. These things always exist in life, in American life, for example, but they are oftentimes in the shadows. That the ways in which our habits are taken for granted, expectations, very rarely account for thinking about what if something goes wrong? What if I can't plan for the future? What if all the things that I thought I was going to be doing this semester or this quarter or this summer are taken from me? What if I can no longer bank on that? How do I live? How do I make sense of what's happening? How do I experience the moment? How does time change on me? How does my own sense of mortality shape what I value and the ways in which I think about my experiences and the ways in which I make meaning out of who I am and what I'm doing in my life? So these are the things that I think about every day, and now it's heartening to think about how others are talking about it. I wish it wasn't. I wish we didn't have to talk this way, but at the same time, I think there are things to glean and learn that we can draw upon from this experience.
So when we at Digital Charlotte, we think of the communities and our partners in a very specific way, at least in terms of the way that we engage with community is typically through three groups. Is one, we think about organizations, other nonprofits. We think about companies, their corporate social responsibility or philanthropy, and then we also think about government agencies. And driving awareness of the issues of sort of broadly digital literacy and digital media literacy or digital inclusion, and now thinking about digital health literacy as well, thinking about how do we provide them a really deep level of understanding and sort of the education phase of what we do. We have our awareness phase and our education phase. And then our third is really the action. So once you become aware of something, once you've been able to have a deep level of understanding about it, then there's this sense of responsibility to drive some sort of action. So when we think about just to sort of take that and look at, if we're imagining that one or all three of those audiences or someone representing those audiences is participating in this conversation today, whether they're watching the live stream now or watching their recorded content, they're in a nonprofit organization, perhaps it's a care organization, or they're a government official who is thinking about what they should be doing right now as it relates to some of the issues that you have expertise in. What would you say to them? What are some sort of broad things, but also perhaps some really practical things that they could be thinking about as we have to communicate online, as we can't go into the facilities where we used to care for people in person? Just what are your thoughts on that?
That an individual or organization or a community's digital literacy makes a difference between life and death. It is no longer a privilege. And I think that's something that we're realizing because physical movement and social distancing are requiring us, and thankfully trying to slow the spread here of coronavirus. But think about where we are. We're now situated apart from each other. But the question about how we can become together, even though we are apart, is really in essence a matter of one's capacity at the organization level or the individual level to be able to seek information that's relevant and useful, be able to find that information time and time again, to be able to understand what that information means for you as an individual or a family or organization or a community, to evaluate that information, to know what is reliable or trustworthy, what you can believe, and what may not actually be factual or helpful to you, and then to be able to do something with that information, to advocate for your family, to create understanding for your neighbors, to share with friends and family for social support. That, in essence, is what digital health literacy is. Do you have the skills and the capacity and the reflection components to be able to make sense of all of that in this most challenging of times? And that's where the health component comes in. I mean, when we talk about this in abstraction, it's like, yeah, these skills are important for people and we should do this. But right now, as I know Digital Charlotte talks about all the time, health is an integration of all of those things. So if you're filing for unemployment insurance, you need to be able to know how to go online. If you are trying to find out what's going on in North Carolina, in Mecklenburg County, you need to be able to go to mecnc.gov. If you need to know what the governor has said in terms of the new policies of social distancing, you need to be able to go to the NC Department of Health. And at the same time, you're bombarded and creating all kinds of messages that have been demonized in ways that we have not fully realized. And so when we talk about health, it's the difference between essential knowledge, helpful knowledge, useful insight, the capacity to find wisdom in the most challenging and uncertain of times. And if I might, Bruce, I mean, let's be honest. The threat of coronavirus or any kind of health situation for your family changes the game, doesn't it? Because we're not talking about interpreting information the same way we were a month ago or 2 months ago, right? So that makes what we're doing, and if organizations are listening now, what your employers are doing, remarkably important. The way we make sense of information is kind of interesting. It's trying to manage our uncertainty and integrate that into our everyday lives. So there's a couple ways that we do that. And one is we evaluate probabilities. And this is what we were doing for the last 2 months in America. What's the likelihood of coronavirus coming to the United States? What's the likelihood of coronavirus affecting my demographic? What's the likelihood of coronavirus making it to North Carolina? What's the likelihood? We kind of go through this probability game, particularly for experiences in which we do not want, right? I mean, none of us wants coronavirus. None of us wants anyone that we care about to get sick. And so when we try to evaluate probability, and then you add the layer of something I do not want, it becomes remarkably problematic and challenging to be able to incorporate that and make sense of what's happening. So it shapes how we seek information, how we interpret information, what information we share, and how we make meaning from those experiences. And those are real high-level digital literacy skills that if our employees, if our community members, if our leaders, if our citizens don't have, then we risk peril because we see the real impact now. If we don't understand what social distancing means, if we don't get real-time information, if we don't know where to go to testing in Mecklenburg County or wherever your particular community is, we're going to have real challenges that impact not just ourselves, but other people.
Maria, I think you had a question.
Yeah. So I have a question. You mentioned how we're being exposed to so much information, like almost all the time. So what do you recommend people to basically stay sane and don't panic with so much information being thrown at them?
Nearly impossible to say. I mean, on the panic front, I would say that, I mean, inevitably, because we're interpreting this information, because we see direct threat and direct concern. And this is so fascinating, and I've written about this, the idea that when it comes to vulnerability, this is something that in American discourse we don't often talk about. We'd like to think that if you're young and if you're in a demographic that isn't, the kinds that I talked about, people I typically study, research, learn from, and interview. These are people who with physical challenges, whose lives have been radically interrupted by caregiving, by ability, and by a variety of life issues. We like to think, well, that's not going to happen to me. I don't need to pay attention to that crime report. That's not going to happen to me. I don't need to pay attention to what's going on in the other part of the world. That's not going to happen to me. But when we see the possibility that a young person, an older person with underlying health conditions, someone who doesn't have underlying health conditions, we have no ways of de-identifying from the threat, the possibility that we might see ourselves just for a brief moment as kind of this immoral imagination, seeing ourselves in the stories that we see on the news or are shared across social media, that we might need to be going to the hospital, that we might find ourselves and our lives immediately upended, that we might have a ventilator. So these are things that are both rational and at the same time, they defy rationality because no information assessment is understood in a vacuum. And so I will say this, one takeaway, Maria, that I hope people take from this is that digital literacy cannot be separated from our relationships with other people. I mean, to simply go online and only live in that space takes away the ways in which we learn. And I want to highlight what in the research we would call interactive literacy. And that's being able to really assess and discern meaning across the information portals that you have, across your Facebook feeds and your Instagram feeds and your Snapchat and all the tools that you're using to be able to understand what information is relevant, to discern that information, and then perhaps most importantly, to reflect on where you're doing it and what it may be doing to you. This is really hard, right? Because as the situation evolves so quickly, it's really difficult for us to be able to step out of that and talk to our friends or our family about what we're hearing and what it might mean. But oftentimes we're reacting in the moment. And in the course of a day, you might find an hour in which you feel like I have this under control. And then the next hour you think, oh my God, I'm really overwhelmed by thinking what might happen to me and my family. So it is most challenging of times to interpret and make sense of and use and share information appropriately. If I might, I think that, there's a lot of, we have the capacity to share information with people in ways that we haven't had in this kind of shift to Web 2.0. I mean, any one of us can be information creators, share stories, and sharing a story from somewhere else is a type of information creation. But have any of you heard or seen some social media sharings that you thought were untrue or didn't quite ring true? Anyone want to provide one? We can talk through it. Why it's resonant for people, why it works, and how we might be able to use some of our digital literacy skills to help make sense out of it.
Well, I feel like early on when COVID was, I don't even know if it's infancy internationally, but there was like home remedies that people were kind of sharing that weren't true. One of them involving drinking bleach. I think it was like a big one that was like, if you drink like trace amounts of bleach, it could kill the virus. And, I remember seeing a lot of people being like, that does not happen. But it took a lot. I mean, it probably takes a lot of resharing or some sort of movement for that to even be a thing where someone would say, hey, I heard from someone else that if you drink bleach, this could happen or this could help. Right.
Yeah. Talk about how dangerous something like that can be, right, Andrew? I mean, and if we use kind of critical literacy and understand, and we have to really think about what we're experiencing and seeing. And that takes real skill because you have to step back from what you're seeing. And it comes from a desire for people to be able to impose some semblance of control and management of what's going on in a fluid and seemingly uncontrollable situation. So you mentioned the bleach situation, which of course that will not work, that does not work. I've noticed one similar to that. There's iterations of this, of gargling particular types of water and being able to having friends of someone from the CDC and then friends of people who are physicians or others. So it's always this insider knowledge that is being shared in a variety of ways. And then it's shared, and it comes from a space of wanting to help people, but also a space of wanting to establish a sense that I can do something in this scenario in ways that no one else is providing me. And I'm going to share it with my own personal networks in ways that will help them. And on the one side of the continuum, Andrew, the bleach is about as bad as it gets. You could harm yourself in ways that are more harmful than anything you could get. On the other hand, there might be more innocuous examples of that, gargling water, but this is why digital health literacy is so challenging. You have to be traditionally literate, like you have to be able to read and write, okay? That's challenging enough, particularly when we're under duress. We have to have some health literacy. We have to know some terminology, and we're learning all kinds of terminology. We use this thing called COVID-19. None of us were talking about coronaviruses 3 months ago. We have to have information literacy. There's been some incredible articles written in very well-esteemed publications, and they provide all kinds of numbers and data seemingly, but do we know the difference between rates and probabilities, between percentages and raw numbers? It's challenging for many of us to be able to discern that. And we're just looking for, well, this has all kinds of aggregated data. This must be true. When we have a variety of experts disagreeing on the extent or the scope, there's scientific literacy that we have to bring to bear, which is, how do we make sense of what some of this means scientifically? How does science work? How long does a vaccine take to go through the whole process? And then media literacy speaks directly to what you're talking about. 10 years ago, we would not have been able to share that. So what is it about the way in which our medium, so our phones or our computers allow us to do something so quickly without any effort? It's easy to share something, and it is a sign of care for your community. At the same time, I could give you a list of reputable websites, but oftentimes that's like saying you're going to read a book rather than, pay attention to a 2-line blurb. I mean, our attention spans are such that we're going to go to that which is shared by our friends. So we're not only interpreting the source of the information, but the way in which someone shared it, who that person is. And that's why a lot of these shares involve like insider knowledge and friendship circles that I have expertise on that not everyone else knows about. We like to feel like we're in the know. So there's health literacy is that ability to incorporate all of those and integrate them in a critical way. So very hard.
So, so very hard is, I'm feeling not overwhelmed, but just hearing, it's complex, right? And when we think about serving community and when we think about the most vulnerable communities amongst us, and even those with the highest levels of reading and writing literacy and very high levels of digital literacy, I think you sort of made the point, it's even challenging at that level. And oftentimes most times the organizations that we collaborate with at Digital Charlotte, which is an initiative of the Knight School of Communication at Queens, are in communities who have an opportunity to have higher levels of literacy. And so they may not enter these conversations with many of the skills that you mentioned are required. And so we think about those organizations who serve those communities, who have trust in those communities. I know we collaborated on an initiative with the YMCA where we saw some of this in action. But if you are in one of those communities and you're in your social network is telling you something, and that the guard is going to be deployed tomorrow and we're not going to be able to go to any parks, or we're going to have to be on lockdown, or whatever the rumor may be. What sort of practical things might you tell them to take that social interaction? Where should they go to sort of validate? Maybe it's more on the health literacy side. Like, I know you said that it might not be the best idea to just give websites, but like for somebody who really needs to, is curious, how do they take that social interaction and that online interaction and find the connection between the two? Like, where would they go online to find reputable health information right now?
So going online, I would recommend a couple of sites. I mentioned mecnc.gov as a kind of a place to start locally. NC Department of Health, ncdhhs.gov. In terms of kind of medical scientific websites that will help you provide a baseline of a terminology or at least general understanding, we'll start broad with something like the World Health Organization. So if you want major context about how this is impacting and where it may, just kind of a large context, World Health Organization. Then, of course, I would recommend the cdc.gov, the Centers for Disease Control, as a way of just, these are as honest brokers as one gets, and the .gov and the .org oftentimes are keys to us. They have to be incorporated within our social context. So anything you read online from any site should also be funneled a variety of ways, and we'll talk about that in a moment. I would also encourage, I think something like Mayo Clinic is an excellent source. Healthline.org, all material and articles on that website have been verified and approved.
Just to jump in on that one, sorry. I have been working with you now and learned these skills, which I've been fortunate to incorporate into my life. But in the last few phone conversations, especially, to be honest, especially with my dad, who consumes some of his news from a source that may or may not be as reputable, I sort of follow up and say, did you verify that on Healthline? Have you even looked it up? And so even in my own household, my wife now is used to me saying, and she'll come and say something, and I'll say that could be true. I don't know, but like, can we look it up on Healthline? And nearly every time, just to sort of provide an anecdotal example for our audiences, there's been some really relevant piece of information on Healthline that cites its sources, that has an author, that's dated, that gives you all the other pieces to combine with the social interaction to allow you to help you make a decision on what you believe. So just a plug for the number of these that you're talking about and how they get incorporated into our lives.
Well, I think that's a great point, Bruce. I mean, so when we find information like from these reputable sites, it just begins there. It doesn't end there. So then how do we use that information to help our family and friends, or help us to make sense and create some coherence? And many of us right now are going through experiences where our loved ones are sharing information to us that we think is inaccurate or not necessarily fitting within the overall context of what we would consider important or salient information, because we don't come to any information without a lens. And it's when we watch our favorite television show or programming or our political points of view, it's not as if we are all of a sudden objective arbiters, because we care about that. So whenever we care about something, there's a lens of ideology that comes through, that we see what we want to see and helps us confirm what we already once believed about one's will. I'm going to work no matter what, or this COVID-19 won't affect me because I'm healthy. I don't have underlying health conditions. Well, all of these come to play in terms of how we interpret that information. And so, like you did, Bruce, I always encourage people to have multiple, not just sources on the internet, not just multiple sources of information that we just talked about, but multiple sources that you share with other people to talk through them, that critical component. This is what I'm seeing from this website, or someone that I know shared this with me. And you need to talk about it in the context of your family, in your own networks. And here's one of the challenges and opportunities that I think we oftentimes don't think about when it comes to digital health literacy, and that's social support, or what also could be considered social capital, which is a really fancy way of saying, how do we expand our networks, even when we're at home, in ways to get better information, access to people and providers that may be of value to us, and to help us put things in context. And there's some real advantages to being able to expand our network. For example, you might be at home thinking, oh my goodness, I'm getting only one type of information from my family. I'm only hearing this. Access what we would consider kind of weak tie networks of families, friends, networks of people who are not part of our family and friends are excellent sources of insight for us, because our family and friends have shared experiences. They are so similar to us that in everyday life, that's important and valuable. But when it comes to situations like this, it may be helpful to reach out to people who are different from you, so that you can glean their experiences and their insights and broaden your information and knowledge horizon there.
Maria, you had a follow-up question, I think.
Yeah. Might not be on the same subject. Can you hear me good? Because
yeah.
Okay.
Yeah.
Perfect. So as a professor from the night school, have you seen a shift in your students before, just studying the theory and now going through everything and applying learn? Have you seen a shift in how they think or how they act?
I hope so, Maria. I teach a class right now called Health, Illness, and Resilience Narratives. And my goodness, I sure hope that we are. Luckily we have the opportunity to go through this and talk through it together to apply some of these things that we're learning about. But it is the inevitable disparity between what we learn about and how we incorporate that into our everyday lives, because our sense of coherence has been radically disrupted. And there's no predictability about what's happening today, let alone tomorrow, let alone next month. And so that changes someone, and it changes our ability to think about our own value as people and contributors when we're no longer in our workspaces or we're no longer next to each other in a classroom. So we're in disparate spaces, and that sense of community is much harder to reconcile. You may forget that you're part of a community. You may forget that others care about you. So your own sense of value may be threatened. And a sense of meaning about what it is that you're doing and why you're doing it is also threatened. So I do fear that for some it may be overwhelming. And sometimes one way we do that is we kind of avoid information, avoid other people, and find ourselves thinking that other people are radically different from us. This is one challenge that I oftentimes see in caregiver populations, is that there's a heightened sense of difference. And there's an overemphasis on how you are different than other people, which is exactly the wrong and challenging experience to have, even though it's inevitable in this process, because the more different you see yourself from others, the less likely you are to contribute, to go online, to be able to connect with others by phone or other means. And that hyper-awareness of difference is a challenge, and it negates this one aspect of resilience that I've been talking with my students and we've been studying, is the greater sense of connection to others. If you see yourself as part of the human condition, if you see what you're going through as part of what other people are going through, you are much more likely to be resilient. The moment you think you are alone in your experiences, then you're less likely to be resilient. And so that is a real opportunity, because we are apart, but we can be together. And I think that's a shift from perhaps even 2 months ago, when many of us might have been together, but we may have been apart, that we experienced individual experiences, individual challenges that we didn't share or know how to share with others. One advantage is there's a collective consciousness that all of us are going through this to some extent or another together. And if we can lean into the idea that we are connected to others, we're more likely to be self-compassionate, Maria. And self-compassion means being mindful of your experiences and being aware of not trying to label yourself or your experiences, which I know is happening to my students and myself and most others right now, where you don't know how to assess your own productivity. You don't know how to assess whether you're doing okay. You don't have any benchmarks like you normally do about progress or a sense of moving towards something. And one of the great enhancers of compassion, kindness to self, is a kind of connection to others to help and see how others are modeling and navigating through their own experiences.
It makes me think of this. When we think about our three audiences, I'm thinking about government and perhaps a combination of elected officials and government staff, and thinking about city staff and county staff. But, there's lots of the press conference sort of being talked at, maybe the reporters, but also, thinking about elected officials who, they're sort of the press, the flesh, the in-person where they perhaps do their best work. They go to community meetings or they deliver in-person communication. Like, what would you say? Do you have any thoughts about how those audiences can help create that connection to help people feel part of this community or stay connected to each other? Is it as simple as them, getting in front of the camera and having more intimate conversations, or what are some tips that you might provide them?
I think here diversity is important, and that means that not one form of communication is going to work here. Because of the complexity and the radical uncertainty of what's going on, I would highly recommend for government officials as well as community leaders to communicate with their communities in a variety of ways. because over a period of time, that will help achieve that social presence that we take for granted oftentimes face to face. So it might be video chats, it might be webinars, it might be a personal phone call, it might be an email, it might be chat rooms. There's got to be a variety of ways in which to reach people, because people, the way in which we communicate to large groups, kind of a broadcast, different than the intimacy that we might get more one-on-one or small group, where there's more reciprocity and people being able to contribute rather than, as you say, being told. Because the challenge here is that information alone is not going to console people. Information integrated within an organization or community's value system is essential. So kind of reclaiming what is it that we value? Who is it that we value? Those are the ways in which you're going to help remind your employees, your citizens, your colleagues how to make sense of what it is they're hearing and how they should respond. And it will also reinforce that sense of value. So instead of, it just provides a benchmark, an anchor. I think that's particularly helpful when we need criteria. We need ways to make sense of all this information. New information alone will not make us feel better or make us feel like we have some agency or capacity to impact what we're doing. But if we know that an organization I'm a part of is really committed to creating a sense of belonging or care for people in senior facilities, well, how can you organize in your neighborhood or within your organization to reach those organizations? And what can you do? How can you leverage your skills? How can you create a sense of value? And asking your members what that value is. Everyone has value, and recognizing and tapping into that value. And then as an organization, being able to leverage that will provide people the opportunity to contribute, to see the impact, and also create that sense of connection. And values and beliefs are that which are going to connect us when we're physically apart. Typically, like an organization's buildings, when you walk in, you're reminded like we're here together for some reason. We don't think about it explicitly every day. But right now, the ties that bind, the tissues that are going to connect us are the values that you and your organization, or the mission statements. This is when that really needs to come into play, because if it doesn't, you are going to leave an individual out, alienated, trying to figure out and navigate amongst the onslaught of information that doesn't provide a benchmark, doesn't provide an anchoring point.
Which really exposes I'm imagining us on the flip side of all this and thinking about it, to be really honest, in the context of our own relationship to the university we work at and the communities that we're in and our own collaboration. But it just thinking about how this moment really exposes weaknesses in those. It can do the opposite. It can highlight the strengths. It can highlight the way that the mission statement is actually lived out. But it could also do the opposite and really highlight how the mission statement isn't actually lived out. And I'm not suggesting that's the way it is in our work, but just for others out there, right, it's a really a moment to feel that way. And Maria, I'm sort of wondering how, from a different perspective that you bring, like, how do you feel that connection? I know you have, not here, some all over the world, and also then your connection to the university. What do you think about this?
About connection.
Yeah, especially in this what we've been talking about, and a lot of you mentioned the other day about information that your dad isn't able to get and things like that. But just curious what you were thinking.
Well, my mom and my brother are in Spain, and my dad is in Venezuela. I have friends all over the place, and I feel like we have been more connected. I have people reaching out, knowing what's going on in the US. I reach out to people who are in Costa Rica, in Italy, and stuff like that. Everyone is checking on each other, so I have been seeing that sense of community. And it's good because this is people I have never talked to. I have one friend he's from Venezuela. He's studying in Japan, and he went to Venezuela to visit his family, and now he's trapped because of all the borders. So we all checking on each other. We all trying to share our stories, and it feels like we're not alone. And it's important, especially for my Venezuelan community, to just reassure that we're okay. And with my dad and my mom and all of them, like, it has been hard to find information that they can consume because, Trump might be saying something, and then you have this long article that my parents cannot defer, and they cannot make meaning of all of that. Like, what does it mean? Does it mean that you, as my daughter, are going to get $1,000, or is it only going to be the Americans? Like, they have a lot of questions that I don't even have the answers, because having to understand all of these policies and just being a regular person sometimes is hard. Mm-hmm. So you have to look up for different articles that break down everything for you easier.
Mm. I think you bring up a really good point, Maria, about, at this point, all of us are, the key point here is feeling socially included or socially excluded. And that shapes not only how we feel, but also how we interpret. And I think whether it's in a family situation like you're talking about, what you highlighted, Maria, were two important areas that I think all of us can employ using digital skills. One of those is visibility. And, what ways are your friend networks or your family networks or your organization networks or community networks highlighting the potential to observe and be observed by others who are in similar situations? We need models right now, and that is what we're looking for, and that's available to us. Who is modeling the kinds of behavior, outreach, inclusiveness that we want to see? Because that will help reinforce the values for ourselves. And then, as you mentioned, Maria, availability. What we now notice that we did not before is that we can and should be available to others in ways that a litany of busyness before seemingly kept us from doing, right? But now there's no excuse not to return that text. There's no excuse not to reach out by phone or to email someone or to connect in whatever platform you feel comfortable, so that and let others that you care about know that you are available. That sense of inclusion rather than exclusion, that sense of belongingness, will shape so much about how you feel about the information that you're receiving from the president on down. And it changes so much because it reinforces the idea that you are in this with others that you care about. Mm. And we can achieve this digitally. We truly can. We are. You see it in a variety of ways, but we need to see it not just generally, we also need to enact it in our own lives.
That's I think about the advice for organizations right now based off of that comment and that exchange there is a combination of one, what you said earlier, is communicating using multiple channels and multiple different ways of communicating. But being available and creating the idea that people are seen and heard. And so for some organizations, they're the one that just mine is not related to this right now, but in a company that I've seen do this well is American Airlines. If you tweet about an experience with them, they generally, even if they're not giving you the answer you want, they're recognizing that is there. They offer up some information in a back and forth, so you feel recognized. And I know oftentimes, even if it's a good thing or a bad thing, just that sense of being seen is I don't know, makes me feel good, I guess is a simple way to put it. So especially now, organizations who struggle with their digital literacy skills, even at the organizational level, if they have a Twitter account or they have a LinkedIn page or a Facebook page, and how are they leveraging these today to create that sense of connection with their communities? And I'm really excited, although I'm still somewhat pessimistic about what the long-term implications of that are. How do they take this moment where we all are remote, and once we are able to come back into person, face-to-face contact, how do they continue to leverage those, to your point, so that it's the in-person combined with all of these other ways to create that sense of community and connection?
I think it's a great point. I surely hope we don't unlearn both our capacity to connect. We are connecting organisms. We will find ways to connect. There's always advantages to connections based on the medium that we use. So there's no one form of connection that is superior. What we default typically to a face-to-face encounter because that's our baseline. And that's an essential one. And so when we are able to return back to face-to-face proximity, you're right. If we can leverage and have a discussion about what we want and need from shared space and leverage that shared space in ways that are meaningful rather than take it for granted, then I think we're somewhere different, because we are learning and leveraging and I hope recognizing the value of connection. Despite, no matter what happens in this situation, we must connect with one another. One advantage that we haven't talked about that is available to us online that isn't even available face-to-face is a greater sense of control of your own messaging. And I'm talking about this not just at the organizational level, but I'm talking about interpersonally with someone. So online, if you're in a chat room or if you're in a Facebook group, you have much more control about the message you create than you ever would face-to-face. Like if you and I, Bruce, were face-to-face right now, you'd be looking at what I'm wearing, you'd be dominated by the sounds and the space around us and your other obligations. But if I'm communicating to you in a support group or something like that, I can craft my message in a way that I want, which enhances my own ability to make sense of what's going on and to get across what I want to be heard. And that goes to this sense of availability. You can also respond, and those in those chat rooms can respond when they're available too. But one of the most challenging things for employees or people who are going through difficult situations is they don't feel that there's space or invitation in their face-to-face interactions. We're talking about things that are most important to them and going on in their lives. Now is the time. This is going on in all of our lives. We have the capacity to think about on how we want to shape the messages that we want and how we want to be seen and interpreted. So you won't interpret the way I'm saying something. Online, we interpret more of the what, not the how. That if I stutter or stammer about how I'm trying to get across something very difficult, I'll change the subject or will be interrupted in a face-to-face interaction. Unlike online, if I find the right space, a credible space, to be able to share particular challenges that I'm going through, it can be remarkably valuable for people.
So we're coming close to the end of our time, and Andrew and Maria, I wanted to just first make sure if there was any other questions that you wanted to ask. I had a couple more, but wanted to see if there's anything you were thinking about.
I had a slight one, which was, what has anything changed as we are kind of in this new normal that everyone's calling it? Has anything changed in your opinion of digital health literacy, whereas before it might have been a hypothetical and like, if this were to happen, my assumption would be this would be how this would play out. But now that we're kind of in this spot of more telehealth, I mean, my family, I was in a FaceTime group chat with my in-laws, and one of my brother-in-laws had to step out because he had a telehealth consult because he was having a scratchy throat and he didn't know what was happening, and he was hoping it was strep, and he had to leave so that he could go on this telehealth consult with a doctor. Things like that. Has there anything that's now that we have to put in practice that was more of just in theory before, that has changed in your mind or in your opinion or just how you view things?
Well, I think that it's a great question, Andrew. And I think that the premise that digital inclusion, digital equity, digital health literacy is somehow a luxury of life has to be put aside forever. That these are the kinds of skills that are vital and essential and will become even more essential as we go forward to maintain essential social ties, community connections, awareness of health threats and health opportunities. That we're not talking about something that is on the fringes. We're talking about something that is, as we're learning about day to day, essential to our everyday functioning in terms of economics, but also in terms of health. Just some research. I mean, the research is clear about health literacy, Andrew. It's believed to be a stronger predictor of health outcomes than social and economic status, education, gender, and age. That's health literacy. And so we can't separate health literacy apart from digital health literacy. And that means that as a society, if we're not versed in the capacities to use the technologies and the tools for telehealth, to access insurance benefits or to get a driver's license online, then we're really impacting our own capacity to be citizens as well as to contribute in a way that we have to now. We don't really have a choice anymore. I mean, the choice of right now, physical proximity has been taken away. And I think some of the stereotypes about who can benefit most from this technology is only for young people. We're talking about literacy components that are vital for all parts of our population. Some of the greatest use, the greatest growth in use amongst social media and online platforms are caregivers and the elderly. People in the most vulnerable situations have, in the last 10 years, recognized something that most of us haven't recognized yet. Deep community, belonging, understanding, awareness, access to diversity of sources is available for those who are willing and able to develop their online skills to be able to leverage those. And no one can be left out here. There's not one demographic population that doesn't need the kinds of skill sets and aptitudes we're talking about.
I'm imagining whether it's right now or whether we package this up and send some of these things that you just set out. But, the space at the table here in our community for our major healthcare providers to be engaged in this digital and health literacy conversation. And I know they are in their own ways, but even thinking about ways that our work can be impacted by their presence and even more broadly in the work of the Charlotte Digital Inclusion Alliance. And so, almost like a little self-plug for those at Atrium or Novant or other major healthcare providers here in our community to an invitation, I should say, to beyond what you're already doing to come into and have these conversations and allow us to learn from you and hopefully you to learn from us, because I think as Dr. White has shared, there's an incredible intersectionality between the work that we both do. So perhaps with that, is there anything else that you want to share with us today, sort of giving you the opportunity to close us out?
I just want to thank you for the opportunity and to highlight the good work that Digital Charlotte has been doing in the community for years. And whether that's, in the community, in the classroom for students, across organizations, this is the kind of work that all of us need. Even though you may think that you are technically proficient, it doesn't necessarily mean that you can't gain or glean ideas, insights about the ways to connect, the ways to interpret information, to leverage the knowledge that you have and gain from going online to impact communities that are of value to you, to find and discern wisdom rather than simply sharing what first comes to you. We are all responsible for what we create when we share something. We're all content creators now. And so no one, I think, is immune from saying, there's a lot I can learn from enhancing my own digital literacy. Because in essence, what that means is I care for my family, I care for my community, and I constantly want to learn how to think about and ask myself questions about how I might be able to do that better and more informed in ways that are significant and valuable.
Well, we appreciate your time as always, your partnership, your collaboration, sharing your expertise both with us and our audience. And he did not ask me to do this, but mentioned several times caregiving. And if you are a caregiver, I highly suggest you check out his latest book, The Unexpected Journey of Caring: The Transformation One to Caregiver. You can find it on Amazon. It should be in the essentials delivery category at this point, in my opinion. I don't know if anybody from Amazon is listening.
Thank you, Bruce.
But incredible wisdom that you shared with us today. So thanks again, Dr. White, Associate Professor of Communication at the Knight School of Communication, Queen's University. We appreciate your time.
Thank you all.